Hi class! In the last video we talked about gender differences in anxiety disorders, and now we're going to talk about racial and ethnic differences in the prevalence of anxiety. So while this study is a little bit older, in 2010, we see that there are still some differences in the prevalence of anxiety disorders, and this is lifetime prevalence. So really looking at, over the course of your life, have you been anxious? We see some differences here. First of which is social anxiety disorder. Here you can see white Americans are more likely compared to African Americans, Hispanic Americans, and Asian Americans to be diagnosed with social anxiety. We see a pretty similar feature for generalized anxiety, panic disorder, and in this case, it was a little bit of an older conceptualization, so PTSD was in here as well. But you see for at least these first three, which are kind of our traditional anxiety disorders that we see in the DSM-5, we see that there is a higher rate for white Americans compared to African Americans and Hispanic Americans, and least of all Asian Americans. We see this a little bit more when we're talking about just general prevalence rates too of any type of mental health issue. We do tend to see Asian Americans are less likely to report them. It might be a reporting issue. It might also be, how they talk, the different types of coping, right? We talked about that when it came to culture. So there are some differences, and some of it might be due to some of these cultural understandings. So, like we talked about, culture can influence how we think about anxiety. Or also there might be some cultural differences in how this comes up. So in our social anxiety disorder diagnosis, we have, a fear of being not criticized. Fear of criticism, a fear of embarrassment, and it is due to somebody else's opinions about us. In some more collectivist cultures, such as in Japan or China, offending somebody might be more what we see. So instead of being anxious about the fact that I messed up, or that somebody's going to think I'm weird because I stuttered over my words, instead it's I'm afraid of offending somebody else. And so that might change some of those rates of diagnoses potentially. Or, instead of thinking that it's an anxiety disorder, in Hispanic cultures, ataque de nervios may be, a cultural manifestation of anxiety. So even just like how we're talking about it and how we're experiencing anxiety might be a little bit different. We also see that there are some things that can be really helpful. And that is having a strong ethnic identity. So if we have a strong ethnic identity, especially with Black, Hispanic, and Asian individuals, this can actually protect against psychiatric disorders. So things like anxiety. But, we know that if you are immigrating into America, oftentimes we try to, ask you to conform to our American ideals, and that's really this process of acculturation. So acculturation is just now changing some of your cultural roles to be more towards the dominant culture. In this case, it's kind of the white American culture. And that may actually be a risk factor for higher levels of psychiatric disorders. So, having a strong ethnic identity might actually be really protective here. Another thing we can look at is how severe anxiety can be. And because we all experience some level of anxiety. So it'd be nice to see of those people that actually have an anxiety disorder, is this so severe that you almost can't get out of the house and, might experience suicidality, for example. You see of those people, most are going to be a mild case or, got 43% here. In serious cases, about 22%. So these are the people that have already been diagnosed. Anxiety can be quite severe and disabling, where there's a lot of distress and dysfunction. Another thing to note is that there's a really high comorbidity of depression and anxiety disorders. What we see is that if you have a depressive disorder, you have a 67% chance of having an anxiety disorder that goes along with it. Same thing for lifetime. So if you had a depressive disorder at some time in your life, your chance of having anxiety disorder is 75%. So it's a very high comorbidity. So they kind of go hand in hand. So one of the questions that can come up is, well, how does it develop over time? What comes first? Is it depression? Is it anxiety? How does this work? And anxiety really does come first. So anxiety disorders tend to have an earlier onset than depression. So while you can have pediatric depression, children as young as 3 to 5 having depression, that's really rather uncommon. But anxiety disorders, like having a specific phobia, or social anxiety, tends to come a little bit earlier, right? Like even young kids, like as young as 5, can have a specific phobia. And in this longitudinal study, the majority of the adolescents and young adults who started with just anxiety had developed depression over that 4 to 5 years. So we see that the anxiety really does come first. And part of that might be, some of those, anxiety takes a toll on your body, right? If you're always anxious and having insomnia. So I'm looking at generalized anxiety disorder. If you're anxious, having insomnia, worried about all these things, it can also turn into those depressive symptoms, like the cognitive distortions of believing you're worthless. Those types of feelings might come along due to those anxiety symptoms, like constantly worrying about things. Maybe you start constantly worrying about yourself too. So I'm going to pause this right here, and when we come back, we'll start talking about some of those causes.